So 201, Study Session 13, Fields of Social Welfare Practice. Introduction. In this study session, we will explore and highlight the various fields in social welfare practice. The various practice contexts address certain types of populations and needs and require a special knowledge and skill base for effective work. According to Kirst Ashman, 2007, each field of practice involves a labyrinth of typical human problems and the services attempting to address them. Current fields of practice include children and families, the aging, disabilities, health, mental health, schools, and corrections. Learning outcomes. When you have studied this session, you should be able to discuss the meaning of social work service and also explain fully the relevance of each field of social work to the society. Social work services. Social workers require information about people who need help in each various fields of practice. They must be knowledgeable about the services available to meet needs and the major issues related to each area. A social worker may be called upon to work with a problem that clearly falls within one field of practice or a problem that involves several of these fields. Kirst Ashman, 2007. Other contexts for practice occupational social work, that is focusing on work in employee assistance programs or directed towards organization change. Rural social work, that is addressing the unique problems of people living in rural areas. Police social work, that is emphasizing work within police, courthouses, jail settings, and to provide services to crime victims. And forensic social work, dealing with law, educating lawyers, and serving as expert witnesses. Barker, 2003. Social workers have been in mental health services since 1906. The first social worker in mental health services in the United States was in the Manhattan State Hospital in New York in 1906, and another in 1910 at Boston Psychopathic Hospital. In 1919, the U.S. Surgeon General asked the American Red Cross, ARC, to establish social work in federal hospitals, Skidmore, Thackeray, and Farley, 1997. This underscores the importance and relevance of social work practice in mental health. Social workers work with patients who have been admitted to the hospital, that is, mental hospitals, for the first time, and invariably poses attitude regarding the institution and the program of care that they consider are inimical to their best interests. Also, members of the family bring with them preconceived and distorted notions that seriously interfere with their efforts to assist in treatment plans. To many, the mental hospital is still the end of the line. The idea persists that to hospitalize is to put away, and that once insane, always insane. For some, hospitalization means a loss of freedom. Sometimes, families mistakenly use hospitalization as a solution to their family problems. They have been living with the problem frequently for a long period of time, and their tolerance may have broken down, particularly when mental illness is accompanied by death, loss of employment, economic reversal, or other serious stress. The social worker can help with these family-centered problems. The ill individual is able to respond to treatment best when he or she has the assurance that the family continues to be involved. As the family is helped to mobilize its strength, it can look ahead to reunion and the return to health of the ill member. The social worker is concerned with all aspects of the patient's relationship within the hospital, as well as to his or her family and community. Patients respond to treatment best when they understand and cooperate with it, and can trust the staff responsible for its administration. Likewise, rehabilitation can be achieved best when the patient's interest in family, employment, and the community is sustained while he or she is undergoing treatment. The social worker is often the key person to assist the patient in maintaining sound interpersonal relationships. The social worker also assists the patient in using the family and community resources for protection and restoration to normal activities. Relevance of fields in social work services. The relevance of social work services can be categorized into 6 ways, and they are as follows. 1. Social work in healthcare. Social work in healthcare is the application of social work knowledge, skills, attitudes, and values to healthcare. It addresses itself to illness brought about by or related to social and environmental stresses that results in failure in social functioning and social relationships. It intervenes with medicine and related professions in the study, diagnosis, and treatment of illness at the point where social, psychological, and environmental forces impinge on role effectiveness. Social work in healthcare settings is practiced in collaboration with medicine and also with public health programs. The function of social work in all health settings include, but not restricted or limited to, the following. 1. Assess the patient's psychological and environmental strengths and weaknesses. 2. Collaborate with the team in the delivery of services to assure the maximum utilization of the skill and knowledge of each team member. 3. Assist the family to cooperate with treatment and to support the patient's utilization of medical services. 4. Identify with other professionals to improve the services of health settings through an interdisciplinary sharing of knowledge. 5. Serve as a broker of community services, thus providing linkage of patients needed with appropriate resources. 6. Participate in the policy-making process. And lastly, engage in research to assure a broadening of the knowledge base for successful practice. Social work in the schools. Social work services have been a part of the public school curriculum since 1906, when Boston, Hartford, and New York incorporated the services in their districts. It was initially one of child advocacy, based on individual considerations, but it has now moved away from a child problem approach to one that recognizes that children learn in a milieu that supports learning. The Improving American Schools Act of 1994 ensures a greater role for school social workers in improving educational opportunities for students. The goal of the Act is to help all children succeed at school by making provision for help in specific areas for people in vulnerable groups, such as those with disabilities and the economically disadvantaged. Social workers with parents help to bring about better lines of communication, helping both child and parent gain understanding and acceptance of each other. Family and child welfare services. The family is recognized as humanity's basic institution. The family is fundamental to society. It is a cradle for children, not only physically, but psychologically. The social worker engages in premarital counseling, which is the assistance of a person or couple in regard to courtship and marital plans and problems. Marriage counseling is concerned with husband-wife relationships, plans, and problems. Furthermore, family counseling includes the husband-wife children constellation, problems relating to child discipline, money, education, communication, and so on may require assistance to a family by a trained social worker. Social workers use a variety of helping methods and approaches that include role theory, exchange theory, transactional analysis, gestalt theory, systems theory, family therapy, behavior modification, psychoanalytical approach, reality theory, and bioenergetics. Social work in correctional services. The specific functions of a social worker in relation to juvenile delinquency and crime are: 1. Helping to strengthen motivation, a primary function of the social worker. 2. allowing for ventilation of feelings. 3. The giving of information. 4. Helping the client to define the situation. 5. Helping offenders to make decisions. 6. Assisting in modification of the environment. 7. Helping offenders reorganize behavior patterns. And lastly, facilitating referral. Occupational social work. This is a provision of professional human services in the workplace through such employer-funded programs as Employee Resistance Program. The goal is to help employees meet their human and social work needs by providing services and dealing with emotional problems, social relationship conflicts, and other personal problems. Occupational or industrial social work can be involved in macro practice such as organizational interventions on behalf of employee groups as well as individual clinical activities. The basic philosophy for industrial social work practice is that if a person is upset individually or family-wise, he or she may not be an effective employee. Social work services for the aged. It has been said that no one ever dies of old age. There is no such disease according to the American Medical Association. Yet, almost invariably, aging results in physical changes in the individual. Skidmore et al., 1997. The most common ailments of the elderly are cardiac disease, hypertension, asthma, diabetes, arthritis, as well as disabilities usually associated with old age, namely loss of hearing, impaired eyesight, mental disorders, including senility, and disabilities resulting from accidents, that is, falling. Social workers in geriatric units serve in the following areas of concern to the old people and society: income, physical and mental health, housing, restorative services for those in institutions, employment, retirement, community services, research to improve health and happiness, and lastly, freedom to plan own life and manage it. Other areas of services are drug abuse, rural areas, and finally, minorities, vulnerable, and so on. Study session summary. In this study session, we discussed that child welfare is the traditional term for the network of policies and programs designed to empower families, promote a healthy environment, protect children, and meet basic needs of children. Social workers are concerned with the unmet emotional, behavioral, and health needs of the children. Finally, we explained the relevance of social workers' services. End of SO 201. Thank you for listening.